I think mental health definitely has been stigmatized in the Black community because of our close connection to religion. Like people always say, just pray about it. Especially folks of older ages, unfortunately, people can be stuck in their ways. But there's definitely a stigma, with mental health, because people think that automatically you're crazy, and not understanding that there's so many levels and that there's things that we all can try to work through because they show up in many different ways.
I remember talking to my sister about mental health because for our generation, it's a little bit easier to talk to her as opposed to my mother or my father. And she says to me, I get what you're saying. Yeah, we need to go talk about this trauma, but the powerlessness that we feel when a family member is killed doesn't go away with just talking about it. So what do we do?
It's really difficult, and that's another area that I have gone out of my way to find Black caregivers, because I've had experience with looking for counselors. I've spoken to, again, white women counselors who I was like, you know what, I'm not coming back here. Like, this is not working. You're not listening. You're not really connecting with me. That's why a lot of Black people, avoid mental health care, because it's kind of like, if you're gonna sit there and then not be understood or feel like you're being judged or whatever it might be, then you're being re-traumatized.
I think sometimes when we see these constant killings and these constant murders and things like that from police or otherwise on Black bodies, we feel like we're helpless and we can't really control our bodies in this world. But when you try to at least work from the inside out by working with a mental health professional, you take control back of your body, of your mind. I think that's sexy.
My father is a tall, Black man, dark skin, skinny, and I've never seen my father afraid. He is your typical macho man. His kids would never see that. So we're driving back and we got pulled over. I remember the look on my father's face. I remember the way he shuddered. I remember how angry I became in that moment because I can tell what he was feeling. I could tell the powerlessness that my 50-something-year-old father was feeling. And the way he responded to the officers with the no sir and the yes sir, and he was just trying to survive. And he just wanted to make sure that him and his family didn't end up on the news. My father was traumatized in that moment. My father grew up in Jamaica. I was born and raised in Jamaica. And he was well respected in our community. That was the first time I felt like he was little. That hurt me to my core. And I remember that like it was yesterday. But here's the thing, we never talked about it. We never talked about it. We never talked about it, and I have a degree in the field of psychology. And I try to talk to my family about trauma and race-related trauma. Just like most of us in the Black community, my mother often responds with, "We just gotta pray, baby." No, Mom, we don't just have to pray. We gotta do a whole lot more than pray. Thank you so much for your attention to that video, and I recognize that this topic, this conversation can be quite heavy for a lot of us. I've recognized that this is something real that we're talking about. We are discussing mental health because there's something to work through within the Black community. There's so many things to work through. When you're watching people like you that look like you lose their lives in broad daylight. And when you think about the experience, one of our students wants to talk about post-traumatic slave syndrome, and I'm not going to steal her thunder, but when you think about what our ancestors went through, there's a whole lot to work through. There are a plethora of reasons as to why, particularly in the Black community, it is so important for us to make use of and engage with mental health services. And so today, our panelists are going to be sharing with us why there can be challenges to doing this. Why it's not necessarily the case that we don't want to, but there are some barriers as to getting this information and getting the support that we need to truly be supported through some of these traumatic experiences, both personally and systemically. So without further ado, I'm going to turn things over to our very first speakers of this afternoon. We have with us Tiffany Smith and Nafessa Wiggins. I'm going to be sharing with you a little bit about them, and then Tiffany will share with us, following which Nafessa will be coming to us briefly as well. So Tiffany Smith is a licensed professional counselor. She earned her bachelor's degree in sociology from Rutgers State University. She then obtained her master's degree in clinical community counseling from Eastern University. She is a trained cognitive behavioral therapist and also holds certifications in elementary education, grades K through 5. And last but not least, she is also the owner of SOAR Learning Center, a state licensed private childcare provider, which specializes in inclusive services and offering educational and therapeutic services for children with special needs. Following Tiffany, we will hear from Nafessa Wiggins, who was born in Philadelphia, but raised in Camden. She is an employee of the Camden City School District, working as a site manager in the school-based youth services program. She has her certification in school social work and is a licensed clinical social worker. In addition to serving the Camden School District, she's also the founder of Graceful Path Counseling Center, serving clients through her private practice. What drives her is her passion to empower and equip students, individuals, and families with the ability to recognize and utilize their own strength to resolve their problems. She believes that no life is insignificant and that people have purpose, and are able to live a meaningful life with their God-given talents. With that being said, I'm excited to bring to our Zoom stage Tiffany and Nafessa, beginning with Tiffany Smith at this time.
Hi, everybody, and welcome. I see everybody give a props to Nafessa for being from Camden. I am a Philadelphia native, so, but I'm just so happy to be here. I know that heart for the screen. I'm so happy to be here. Thank you for your time and attention and the concern about the mental health and well-being. Okay, Philly, for the well-being of our Black brothers and sisters and the care of the importance of mental health. So I'm so grateful to be here. I have very little time. I only have a 10-minute window, and there's a lot of ground to cover. So Miss Nordia is going to share the screen. I'm going to go through a presentation for you very quickly, and I'm going to give her a next because she's going to help me due to technical issues. So, so we're going to just keep it moving. All right. So we can go to the next slide. So our objectives for today is to examine the cultural, institutional, and historical influences that shape psychological issues among African Americans. We're also going to discuss and explore diverse issues related to mental health and trauma. And then we're going to consider and reflect upon the impact of our own biases, values, and assumptions, and the relationship to the construction of African American identities. All right, this you may have seen before, but I feel like it's important for us to consider the statistics that 13.4% of the US population identifies as Black or African American. Of those, over 16% reported having a mental illness in the past year. That's over 7 million people. This is more than the population of Chicago, Houston, and Philadelphia combined. That's a lot of mental health. I also want to remind you that only 1 in 3 African Americans actually will seek out services. Okay, next slide. So what are some of the risk factors? And before I want to go into this, I want to share with you, as a therapist, one of the practices I worked at, I was the only African American, and I was a substance abuse counselor. And I had one of my first experiences of racial prejudice and discrimination. And sitting in a group of about 15 to 20 Caucasians that were struggling with substance abuse issues, and a Caucasian lady raised her hand. And before the start of the group, I asked if anyone had any questions, and she said, "I do have a question." And I said, "Sure, what's your question?" And she says, "Please don't take this the wrong way, but do you wash your hair?" And I said, "I'm sorry, excuse me?" And she says, "I just want to know if Black women wash their hair. I don't mean anything by it, but for some reason, it just seems like most Black women that I see look very unkept." And wow, for me to be a professional in the field, and that was the question in the group, I was very taken back by that. However, for many of us, imagine the powerlessness of being a Black woman and the only Black woman that you feel when you feel like you can't respond, because it's almost your case against theirs, and how me getting angry would have impacted my job. And so this is something that a lot of African Americans experience on a regular basis of, how do I have a voice when I am the one that feels like the victim, right? So racism, racial bias, and discrimination, this is a big factor in poor physical, mental health, and racial issues among ethnic minority populations. This includes, and I'm going to go through this pretty quickly, racial profiling, which we know that African American males are disproportionately stopped and searched based on perceived wrongdoing. And many of them, because of this, experience anxiety and PTSD. You can go to the next one. There's also institutional racism, and this is a critical social determinant. That's fine, keep it going. Other risk factors include low socioeconomic status, housing segregation, and mass incarceration. Keep going. And then we have trauma stress. So trauma stress, untreated trauma stress has serious consequences for children, adults, and families. And there are several types, and this includes individual trauma, complex, collective, historical, and cultural trauma. Individual trauma, African Americans are disproportionately experience negative life events, and this includes poverty, victimization, and abuse. Complex trauma, I want you to think of families with multiple generations affected by adversity. This includes those of an interpersonal nature. And most of these begin in early childhood and can disrupt many aspects of development and the formation of one's sense of self. Then there's collective trauma, and this is where we get traumatic slave syndrome and these types of things, where we refer to trauma that happens to large groups of individuals and can be transmitted cross-generationally and across communities. Historical trauma is a big one, and this is how we all relate to each other as far as public narratives of complex and collective traumas. This is due largely to a large history of unfavorable societal treatment, which is what we're experiencing right now. Those public narratives involve shared historical experiences across generations, like lynching, slavery, and our present day experiences of police brutality and mass incarceration. And a lot of these things are the consistent reminders that we feel like we're not human. And this is where a lot of us feel devalued as African Americans. Then we have our cultural trauma, which is such things as slavery. And these leave permanent, enduring memories that we identify with collectively as a group. Historical trauma, I want to read this. It says, historical trauma introduced the concept of multi-generational trauma, which affects individual family responses to trauma and loss. In practice, as a clinician, we have to be mindful, as well as those outside of our ethnicity, that the pain experienced by adults and children may be related to pain, not just of ourselves, but of our grandparents, and our ancestors. So this is important. So trauma through historical lens approach, when we're working with clients, Dr. DeGray said they are going to be dealing with multi-generational trauma. All of us are in some way. You need to be sensitive to the way in which people move through the world if you're going to help them. You have to tread lightly, watch, and listen. And I want you all to listen to this quick video.
The sound isn't shared.
Sound.
You have to unmute whoever has the presentation.
Is a strength. Crying and releasing it is a strength, because it's much easier to say, I don't want to deal with that. When you have to deal with the thing you want to avoid, that's strength. I'm at a point now where my mental health is not negotiable. I wasn't always taught to check in with yourself, see how you're feeling. What happens is that either you're going to learn healthy ways of coping, or it may be unhealthy ways. I grew up in Richmond, Virginia with my mom. I'm her only child, her best daughter. My father, we have a relationship, but most of my relationship throughout childhood was seeing him in a prison. In my neighborhood, in my family, I always knew I was going to college. Even as a first generation college student, you take on that pressure, like, I have to do this. People have expectations of me. And then when you're starting to feel that separation between how people see me and what they want me to do, but I need help. I just started saying, maybe 2 years ago, don't call me a strong Black woman. Because I don't have to buy into that, but if you label me as that, you're not going to see me as a human. I felt the need to form Black Mental Wellness because there was a huge piece of mental health missing, and that was the mental health of Black people in America. So when you think about psychology, you think about the theories, you think about the approaches to therapy, it's all based on white people. What we know to be true is that Black people communicate differently. We have different stressors. And I think it's important to know this because trauma encodes itself in your body. And that stuff is passed down. The stressors and triggers that are unique to Black people in America is our whole existence in America, right? How do you show up? How is your hair? How are you dressed? That's so much stress, and that's not even the job. So when we think about the cultural shifts and changes, the last 2 years or so, it just seems like it's now the in thing to talk about mental health, and it's the in thing to talk about Black mental health. I feel like educated Black people, you know, they like to say like, oh, my therapist said. Every time you say that, you're normalizing that experience for someone else. All of those things breaks down the stigma and opens it up for people. Actionable steps that I share, I like to think about the start of the day. Can you wake up, even if it's 10 minutes earlier, where you can just have that quiet time to yourself? Another actionable step, find at least 5 minutes, go outside and get some fresh air. Because we're spending so much time in our homes or in these enclosed spaces. So many people think that therapy and mental health is for people who are sick. And I want them to know that mental health and therapy is for everyone. There is a space for Black people as it pertains to therapy, and that there's something that we all can gain from being a part of it.
All right, back to you, Tiffany.
All right. You have to go to the next one.
Just a sec. Okay, can we get out of here? There we go. All right.
Okay, so what best practices can we use? So even if you're a staff at a school, if you're an educator or a therapist, we should always remember to connect to core values of Black people, our culture, our family, our kinship, our community, our spirituality. And because the way that a lot of Eurocentric treatment approaches are, they may not necessarily align with vital components of the Black community, like the importance of spirituality in church, or whatever it is that we practice. It's important to make sure we're incorporating that in our work. Also examining how perceived racial discrimination may contribute to anxiety, hypervigilance, depression, and all of those symptoms. It's important to recognize and understand your own personal biases as well. And this includes African Americans, because something we don't talk about is the way that we treat one another and our own biases that we hold. So I want to give you a quick example of that, and then we're going to be done. But we want to talk about trauma glasses, right? So having your trauma glasses off versus on. So a lot of people, when they're not thinking about trauma, may use adjectives such as a person is being manipulative, lazy, resistant, unmotivated, disrespectful, or attention seeking. But I want you to think about it from the lens of someone who may be experiencing trauma. And instead of manipulative, maybe think of things like getting needs met in ways that have worked in the past, or doing whatever is necessary to survive. Or instead of lazy, maybe think overwhelmed, lacking the skills to make decisions about what to do and how to organize. Maybe instead of resistant, think of mistrustful of others due to a history of being hurt, scared, or afraid to lose everything. Instead of unmotivated, maybe think depressed, feeling overwhelmed, stuck, or frozen. Instead of being disrespectful, maybe they're feeling threatened or out of control. And attention seeking, maybe feeling disconnected, alone, unheard, or looking for connection. Okay. Another thing is educating ourselves about the experience of our students within the local community and within your school. Consider connecting with community organizations or leaders to learn more about the array of Black culture within that community and opportunities to collaborate. And that's it. Thank you.
Thank you very much, Tiffany. I'm going to turn things over to Nafessa immediately following.
Good afternoon, everyone. I'm really happy as well to be here. I'm going to jump right in because I know that our time is limited. So I will be discussing today just how are we accessing our mental health services, right? And is it equitable? And do people in the Black and African American community have access, right? So today's objectives, I'm going to explore the realities of access to mental health services for Black and African American people, explore the barriers to mental health care in the Black and African American community, and explore the availability of Black and African American clinicians of color. We're going to briefly watch a couple minutes of a video, and I want to say to you, there is a humorous edge to this video that is not intended to be offensive. However, it does highlight the need in our African American and Black communities for access to mental health.
No sound, Nafessa. I'm not sure if everyone else is hearing it.
Sorry, I forgot to share.
I hear it, it's just really low.
Okay, I've shared my sound now. Let me start over. Sorry about that.
There are few groups who could stand to benefit from therapy more than Black people. I mean, think about all the things Black people have been through: slavery, segregation, winter, all equally traumatic experiences. But unfortunately, even as therapy has become more mainstream, the Black community has had a tough time getting the help that they need.
It's hard enough to get mental health treatment in the U.S., but studies show that racial and ethnic minorities are significantly less likely to receive mental health treatment than whites.
Black and Hispanic children are less likely to get mental health care than white kids. And studies show that irritability in the average white teenager is often labeled as depression. That same behavior is more likely to be seen as disruptive in Black or Latino children, and doctors say that can lead to feelings of hopelessness at a very young age.
Yes, one of the reasons many Black people don't get the proper treatment is misdiagnosis. What is seen as depression in white people can be seen as disruptive behavior in Black people. And this shouldn't be surprising, right? This kind of thing happens in medicine all the time, mixed diagnoses. It's like when a Black person has a seizure, it's a medical emergency. But when a white person does it, it's called dancing. But it turns out, even when Black people are properly diagnosed with mental health issues, it can still be a challenge to find a therapist who's equipped to handle their needs.
Making the crisis worse, not enough African American therapists. Today, only 4% of psychologists are Black.
Kevin Durden says admitting he needed help was actually easier than finding it. He saw 3 different therapists, but felt that none of them understood the stress and emotions unique to Black men.
When Taraji P. Henson's own son, Marcel, was struggling, she found it nearly impossible to find him one.
Trying to find a culturally competent therapist was like looking for a purple unicorn with a gold horn.
Do they understand the cultural context from which I'm coming from? Do they understand the culture that I live in?
That's right. It's extremely difficult for Black people to find a Black therapist. And it's been like this for a very, very long time. I mean, that's why Martin Luther King Jr. was always describing his dreams to huge crowds. You know, it's just like, I had another dream that I'm being chased by bears in my underwear. Does anyone here know what that means? Now you may think that a therapist's race shouldn't matter at all, and that's true, but if you think about it, it does make sense. For many white therapists, no matter how good they are, it can be hard to understand the particular experiences of a Black person. You know, just sitting there in a session, even if they're trying, it could be like, so you say people are following you around the store and you're invisible, but only to taxi drivers? Paranoid delusions. So when it comes to mental health, there's a very real struggle for Black people to access healthcare, get diagnosed correctly, and find a therapist who can relate to them. But if that wasn't bad enough, there are few groups who could stand.
So the realities to access to mental health services for people of color, according to the Health and Human Services Office of Minority Health, Black adults in the U.S. are more likely than adults to report persistent symptoms of emotional distress, such as sadness, hopelessness, and feelings and feeling like everything is an effort. So many of the issues that go underreported, people just suffer in silence with in the Black and the African American community out of fear of what does that mean once I share it, and then number two, where do I go to get help with that? So despite the needs, only 1 in 3 Black adults who need mental health care will receive the care that they need. According to the American Psychiatric Association's Mental Health Facts for African Americans guide, they also say that African Americans and Blacks are less likely to receive guideline consistent care. They're less frequently included in research and more likely to use emergency rooms or primary care doctors rather than a mental health specialist. So Reverend Tiffany talked about some of the stigma around accessing mental health, and I'm going to touch a little bit on that in talking about the barriers to accessing mental health. So one of the barriers is stigma associated with mental health. I hate this word, and I really, when people use it, it boils my blood. When we talk about mental health, is the word crazy, right? Because that word is so stigmatizing and is so labeling, but people use it in a way to describe someone who may be having a mental health crisis or a mental health issue. For many in the Black community, it can be incredibly challenging to discuss mental health because there's a concern about how is this going to be perceived by other people, to know that I've been experiencing a period of sadness, right? There's also a distrust of the healthcare system. You know, historically, unfortunately, Black and African American community have been used in the healthcare system as guinea pigs, you know, to test different, you know, medical research on, and it had not always panned out well. And so there is a longstanding, longstanding fear about, you know, accessing health care, being a Black or African American citizen. There's a lack of providers from diverse racial and ethnic backgrounds. There are not enough people of color doing therapy. The lack of culturally competent providers, right? Because one thing I want to indicate is that even if you are a Black or African American therapist, you still need to be culturally competent, because there are a lot of things that we need to learn about ourselves, as well as other ethnic backgrounds and cultures that we want them to learn about us, right? And we need to learn about them. Also, provider bias and inequality of care. Provider bias, both conscious and unconscious, and a lack of cultural competency can result in misdiagnosis and inadequate treatment. This ultimately can lead to the mistrust of mental health professionals, as you saw in the video. Now, this woman is sharing with this therapist, a psychologist, whoever he was, you know, I'm being followed in the store. Well, that's a reality for us. That happens, you know, so that doesn't mean that I'm necessarily paranoid. It means that that is exactly what my experience has been, right? But someone who may not be culturally aware of the things that are going on from a societal standpoint could misdiagnose me. Uncertainty of where to find providers. Where do I go? You know, I don't even know who's available in my community. Lack of insurance and underinsurance. In 2018, 11.5% of Black adults in the US had no form of health insurance, right? How are these services being paid? How are they, you know, how are the providers going to be compensated for their time? I want to share a story really quickly with you. And this happened in 2003. I had just graduated in 2002 with my master's degree in social work, and I was working for a local agency in the community in which I lived. And I was doing family preservation work, and I'll never forget my client. I was getting ready to transition them from our work together, and they needed to go on to outpatient services and requested an African-American therapist. So of course I go back to my agency and I say, let me see who is available in the outpatient program. And so there was a Caucasian therapist that I, was connected to. And I mentioned to her, I never forget it, we were outside of the agency and we were walking and she was going one way. And I said, hold on, I need to ask you a question. And I explained to her that I had a client that I wanted to refer to the outpatient program and would like to know what African-American therapists were available because that is what my client has requested. And the therapist turned and looked at me and said, they'll get who they'll get. It doesn't matter, whoever is available. And that was my first introduction to systemic racism, even within the provider network. And I was just really surprised, like, wow, so clients don't have an option here, And so, of course, this was in 2003. Guess what? It's 2021 and it's still happening. So I want to just touch on the health insurance issue in the country. So the Affordable Care Act, it was created to provide options for people who did not have insurance or enough insurance, right? So we can provide it for an opportunity to narrow longstanding racial and ethnic disparities in health coverage. And so it helped to increase a lot of areas for people who, again, that did not maybe have enough or did not have any at all. However, unfortunately, there was a stall in how that coverage was helping people. It eventually, there was a stall, and eventually people who were looking to the ACA to increase their coverage or to get coverage were not able to get the coverage that they thought they were going to be able to get. So the coverage rates increased for racial ethnic groups between 2010 and 26, with the largest increasing occurring over implementation of the ACA Medicaid market coverage expansions in 2014. Blacks, Asians, and American Indians and Alaska Natives also had the larger percent point decreases in their underinsured rates. So people were getting insurance compared to whites over that period, beginning in 2017 and continuing in 2018. Coverage gains stalled and began reversing for some groups, with small but statistically significant increases in the uninsured rates for whites and Blacks, which rose from 7.1% to 7.5%, and then from 10.7% to 11.5% respectively. And just fast forward with time, while Medicaid was supposed to help, fill some of the gaps in private coverage for groups of color, prior to the ACA, Medicaid eligibility for parents was limited to those with very low incomes, often below 50% of the poverty level. So opportunities, they remain to increase coverage and narrow disparities by enrolling eligible uninsured individuals into coverage. And these opportunities would increase if additional states would expand their Medicaid options. Now, in reading on this, I noticed that the states in the more northern part of the country, they have expanded their Medicaid options, but the southern states are still behind the 8 ball and have not. Therefore, leaving some people without coverage and insurance. The availability of African-American clinicians. Individuals' health benefits with Medicaid plan does not always guarantee a provider will accept it. For example, what I mean by that is, while there are plenty of private practice clinicians out here like myself, I'm not a Medicaid provider. I'm not able to provide services in my private practice for someone who may be on Medicaid and choose to not go to a larger agency, but they want to see a private practice therapist. So that's something that we still have to work on, supporting and lobbying and getting around so that we can, because once this pandemic is over, and I'm sure that Reverend Tiffany can agree with me, we've already seen a surge in the need for mental health, right? And it's going to be another huge surge once this thing is over. And so people need options, they need choices. Medicaid currently does not allow for certain providers to provide care, like I mentioned. During the COVID pandemic, there's been an upsurge in the need for for mental health services, especially in the Black and African American communities. There was an article in the New York Times where it talks about therapists. There's not enough therapists to service everyone, right? So think about if we are able to expand who can be providers, right? Then maybe that would open it up and more people can be available to service those that aren't able to find available clinicians. Providers that are connected to larger institutions where Medicaid coverage is accepted do not always reflect the racial and ethnic background of the constituents and or have the necessary cultural competency training that would assist them in service delivery. I worked for an agency like that. That person who said that was not, a person of color and did not see the significance and importance of having providers that look like the clients that they serve. So there are many resources which Dr. Johnson is going to share a little bit later, but I just wanted to include them in the presentation of where a person of color could go to search for someone of color to be a provider if that's what their choice is. And that is my presentation. I thank you so much. I know I was kind of speeding through, but I wanted to ensure that I cover everything as related to my segment. Thank you, everyone.
All right. Hi, everyone. My name is Elise Thompson. I have the pleasure of introducing our next couple of student speakers. So first we have Dominique Williams. She is a senior biology major with a concentration in pre-professional studies, and she also has a minor in Africana studies. In addition to her schooling, she is a talent here on campus, and she is the third vice president and the chair of the health committee for Stockton's NAACP chapter. And then before she begins speaking for us, we also have Michael Kilbrew, who, just a second, because Zoom pulled a fast one on me, so I got a little confused. All right, so Michael Kilbrew is a senior political science major here at Stockton, and he's the president of the Pi Xi chapter of Alpha Phi Alpha Fraternity Incorporated, and he is also a board member of the Greek Council. All right, Dominique, take us away.
Hello, everyone. I'm happy to be here today. I'm happy to come here and speak to you all. Today, I wanted to talk about mental health challenges that African Americans experience that are oftentimes overlooked. I recently became a mental health first aider, and so I want to bring awareness to mental health challenges that we face in the Black community. Oftentimes, mental health within the African American community is overlooked by our providers. I personally experienced this when I went to my primary care physician and during a wellness visit. And typically during a wellness visit, they ask how you have been mentally, physically, emotionally, et cetera, et cetera. And I had told her that I had been experiencing some anxiety and some form of depression. And she basically disregarded my feelings and just told me to just shake it off. And I feel that as African Americans, we're often overlooked when it comes to mental health. In my opinion, mental health challenges can be overlooked within the African American community as well because of this thing called post-traumatic slave syndrome. Post-traumatic slave syndrome is a syndrome that basically means that traumas that our ancestors faced still have an effect on how we live and behave today. Some signs of mental health challenges within our community include irritability, isolation or loneliness, significant tiredness, and even difficulties talking about one's feelings. These signs are overlooked because we as Black people have been conditioned to suppress these feelings and just power through them. Historically, which was mentioned before, prayer and toughness is all Black people had to make it through. And they had no time back then to address mental health issues because they were trying to survive. The mindset that this mindset has been passed down through generations, and we often don't realize the severity of these learned behaviors until we reach a breaking point. According to Mental Health America, the African American population experience mental health challenges at the same rate as our white counterparts. We may be affected at the same rate, but we are not treated at the same rate, which leaves an effect on our community. I feel that the number of untreated Black people struggling with mental health issues is higher than we can even imagine. This is because we are overlooked and given the short end of the stick at every given opportunity. This paired with negative experiences that Black people face when dealing with health professionals limits the resources that we have. This is what makes the ABPSI, which is the Association of Black Psychologists, so special. They are a group of Black psychologists who identify as Black first before anything else, and regard themselves as Black before anything else, and dedicate their talents to helping our people specifically. I hope that I brought you some new information that you could take forward to help you forward, and thank you.
Hey guys, can everybody hear me? And Dom, you did a great job with that. I just want to say thank you guys for inviting me to this presentation. So for my kind of talk, I just wanted to talk about like one situation or experience that I had to deal with my mental health. So mental health, especially in the Black community, has been a taboo topic until recently, where others have been praised for expressing their feelings and thoughts. I can recall a situation and a memory of a struggle that I had during school at Stockton. I think it was sophomore year. Actually, I think it was freshman year. It was a whole bunch of schoolwork and other issues that were piling up. And because I was procrastinating a bit somewhat, and also other issues outside of school, such as like the situation just like with police brutality, just kind of thinking about that and learning about it, definitely piled up on me during like the mid March or April. I was feeling kind of drained, unmotivated, and unwilling to go outside. I just wanted to really stay in my room. One day in April, everything just kind of toppled over into something where I had to go to the hospital. So I really do believe that mental health is important for people to actually address, and there needs to be some type of care that is present for Black people, especially when dealing with mental health. Being Black in America specifically, there have been times where I've been so exhausted from all the issues that have been going on in the community. Even though I wanted a break from issues, more kept opening up, basically forcing me to act upon these problems. It became draining at times because you could either see heckling from a racist, or you could see straight up murder from videos or pictures. With all that mixing together with schoolwork and organizational work, burnout is basically inevitable. So there definitely needs to be more talk and more action, especially at Stockton for mental health wise for students and minority students. And I thank you guys for inviting me again.
Thank you so much, Michael and Dominique, for not only sharing your experiences, but shedding light on your knowledge as it relates to the field. Thus far, we've heard some phenomenal talks from Tiffany and Nafessa from the systemic barriers related to access and mental health, to the fact that we can start to shift our mindset as to how we perceive our students. Tiffany talked about shifting your perception from someone thinking someone's being lazy to being overwhelmed, right? So a lot of times in your classes, you may come across students of color who may seem like they're experiencing all types of barriers to doing whatever it is they need to do for your classes. But consider some of these things that are being shared in this context to kind of reframe how you perceive those students in your classes. To continue, we have our final speaker of this afternoon, Dr. Benedict Ezioki, who serves as the Executive Director of Counseling and Wellness here at Stockton. He has a doctorate degree in counselor education and supervision, and he is passionate about holistic and integrated health. This he sees as his mission, particularly here at Stockton, in his role in the counseling center. So without further ado, and because we are quite short on time, I'm going to turn things over to Dr. Ezioki, who will share with us a little bit more about how we can apply a lot of what we're learning to our student populations.
Anyway, generally, I just want to talk about what we should know about mental health. But as you can see, everything is revolving around my role here in the university. And because I believe that knowledge is liberating, both for the student and for the counselors. And I also know that counseling can be very, very helpful, but it can be destructive if it is not handled so very well. So the first thing I want to talk about is what all of us should know about mental health. Mental health problems cut across boundaries, cultures, and geographical locations. So everybody, we suffer from mental health. So there's nothing like machismo, you're too tough or something like that being imposed on you, thereby neglecting the issue you are dealing with. Culture, worldview, beliefs, and thoughts play important roles in its etiology and treatment. The way I feel it may not be the same way you feel it. The way I express it may not be the same way you express it. Likewise, there is no one size fits all in the treatment of mental health. You have to know where the person is coming from, the person's background, belief, and thoughts to know how to approach the person's particular issue. Manifestations, treatments, and solutions, just like I said, no one size fits all approach, because that has destroyed so many people. The way you treated a majority culture person, Euro-American cultural person, should be different the way you treated an Afro-American cultural person, because their worldview is quite different. Their understanding and manifestation of mental health is different. And their existential factors like neighborhood, economical factors, life experiences, circumstances have also implications in mental health. So don't just presume. You have to ask certain questions. In biopsychosocial interviews, you have to go deep and deep and dig deep and don't presume anything, because some of these things are trigger. Developmental factors due to non-availability of requisite amenities and resources could lead to fixated and stunted development, and so may result to personality or and mental disorder. So there are some neighborhoods neglected. So sometimes some of these things are systemic. Sometimes some of these things are ignored. But these environmental and ecosystemic, factors can lead to mental health. So these are the things we should know, all of us here, the government and the policymakers, if we are really serious with solving the issue of mental health. What students should know. Students should know that they are empowered in counseling these days. In old days, is a master-servant relationship, power differentials. Now, in new approach to counseling, the client is the authority, because he who pays the piper dictates the tone. If the client does not present the matter or give you the raw materials to work with, you ain't going anywhere. The counseling process will be stunted. So clients should know that they have certain rights in counseling, and take advantage of that and contribute their own quota in the process of the counseling. Again, counseling is a journey of two with symbiotic relationship. There is nothing like I command and you obey dynamics. Bear that in mind whenever you are going to any counseling, because people have experienced terrible things. That's why I said ab initio that counseling can cure you or can destroy you depending on how it was handled. Remember, student, that you can respectfully ask questions, ask for another counselor, or call to order, or even teach the counselor during the process. You can't be the expert in my own case. I am the expert in my situation. So know that you know yourself better. You know what you are going through better, and call the attention of the counselor, especially the one that does not understand where you're coming from. You have the right, ethical right, to call the person to order, or even ask to be transferred to another person who might understand your circumstances more. And always remember, according to Carl Rogers, that you have all it takes to change. So counseling works. Bear that in mind. Barriers to working with Black minority students. Cultural encapsulation, that is denial of cultural influence in counseling, which tantamount to denial of the being and the essence of the individual, since one is mostly the product of his or her culture. It don't ignore the individual you're working with or impose another culture on the person, expecting the thing to work. It's not gonna work. So, and there is nothing like one culture fits all. You have to respect individuals' culture and worldview. And counseling, because counseling is based on relationship and developing of rapport, if you don't respect somebody's culture, somebody's worldview, life experience, I don't think you will create that culture, that rapport. And I don't think that kind of counseling will work. Denial of white privilege. That contradicts the existing reality everybody sees every day. Own it up, discuss it, will be the best option. Because if you don't, that will affect creating rapport with the client, because that will be lying to the client, and it doesn't work in a relationship. Color blindness. This refers to racial attitudes typified by ignorance, denial, and distortion of the reality that race plays a role in people's lived experience. It's one of those things to manipulate the situation and escape from facing the reality. So there's nothing like color blindness. We have Black people, we have brown people, we have white people. Accepting it and owning it and trying to change the implications of that will be the best approach, instead of just putting it, saying that you are colorblind. There is nothing like that. Color blindness, the four major schematic characteristics of color blindness, racism, according to Silva. First, the principles of liberalism extended to racial matters. There are two different things. It doesn't just say because of individualism or because of we are all free to do whatever we like, that anybody has the right to do or treat anybody the way they want. That is not true. Liberalism is true within the context of freedom. You have freedom beginning and ending where mine begins. So you have to respect who the other is and not explain it away because you don't want to face the reality. Social and economic racial disparities explained in a societal terms, dysfunctional family and structure, and deficient environment conditions. This is the reality of some people's existence. So there is economical and racial disparities caused from the fundamental existence of certain people within certain circumstances like slavery, Black people, and fighting discrimination, policies, and so on and so forth. So there is nothing like explain it away that is just as a result of dysfunctional family structure, a deficiency in environmental conditions. Let's accept the fact that there is this racial disparities and face it.
Dr. Ezioki, this content is excellent, but we are running out of time. And I want to make sure we leave a few minutes for questions.
Okay, let me round up here.
All righty, thank you.
So fear of stereotypes leading to false diagnosis. That's one of the things that prevent Black people from going for counseling. Lack of trust and rapport because they are being ignored, their essence being denied. Imposition of theories. Most of the major theories of counseling are based in Euro-American culture. So some of these theories cannot be applied literally to a Black person. What the counselors and experts should know. Know that you are not the authority, you are just a journeymate. Remember that routine practices and compliance often diminishes the quality of care for Black person. Routine practices are the traditional way of doing things, which are based in Euro-African culture, Euro-American culture, that has nothing to do with the minority culture. Avoid error of using deficient model that only focuses on the client's problems without exploring socio-historical factors and institutional procedures. Why are you only seeing error in these people? Remember that these guys are strong. They are strong. They have gone through a lot and still they are existing, fighting to make it. Why not start there? Like appreciating and celebrating the client's legacy, contextualizing their problems, building on strengths instead of focusing on deficits. They are the better option when you are working with a Black person. Talk about the elephant in the room. Talk about those differences. Don't be afraid of that. Talk about it. That's the only way out. And that will make the client to believe that you truly understand where he or she is coming from. Remember, the tiniest presumption could mar the entire process, inflict harm. So ask questions. If you don't understand anything, do not conclude. Remember where the power lies. The power lies in the client. Be ready and willing to learn from the client because he or she is the expert in their own case. Be a mastercraft person with the ability to adapt and apply major theories to fit the circumstances of this minority person. That's all I got.
Wonderful. Thank you so much.
Yeah.
Thank you, Dr. Ezioki, and thank you to all of our speakers thus far. With only a few minutes left, as opposed to placing you in breakout groups, we're going to continue the conversation right here. We are going to open the floor now for questions from all of those who have joined us this afternoon. If you don't have questions, our panelists also have a few questions to pose to you. Does anyone have a question for us at this time? If you'd like, you can also pose your question in the chat, and we're happy to facilitate from there. All right, well, I'm going to turn things over to our panelists. Would we like to throw out a quick discussion question?
Yeah, I can. I just wanted to ask if anyone has ever experienced any barriers based on someone else's bias or discrimination, any barriers that have prevented you from asking for help, not even for therapy, but just anything that has occurred that created a barrier for you asking or reaching out for help.
Don't be shy. We would love to hear from you. I see a lot of conversations were happening in the chat, so feel free to share that at this time. Well, I do understand that this is a challenging topic to talk about, right? It's hard for someone to open up in a space, excuse me, in a space that requires for them to be vulnerable. That's a challenge. And so we certainly understand. With that, I want to emphasize the fact that you heard a lot here today from our panelists as well as from our speakers. And if there's anything that triggered anything within you, we encourage you to contact the Counseling Center. Dr. Ezioki and his staff are here to support all of you. I saw a lot of comments in the chat about your experiences at Stockton thus far and what you may not have been exposed to by way of Black providers, right? And so we want to ensure that we are here to work towards fixing those issues. And I recognize that some of our faculty and staff have already addressed that in the chat. So thank you. Thank you for acknowledging the fact that there are not only systemic barriers and structural issues and factors that impact the experiences of our Black and Brown students, but there's a whole host of layers of, circumstances that impact their experiences. And so we want to make sure that all of you know, I want to echo what Dr. Ezioki ended with. We want to echo that you all are the experts. You all are the authors of your stories. And it is our job as faculty, staff, administrators, counselors to support all of you. Some of the faculty members even mentioned in the chat that sometimes they don't quite know how to support you, right? They may ask a question and you may not feel comfortable responding in a very vulnerable or transparent fashion. With that, we want to help you through that process. We want to talk through that with you, whatever it is you need support with. We are here to support our minority populations. We recognize the barriers, we recognize the circumstances and the struggles, and we are here to ensure that you all have the support that you need, not only to leave here successfully with your degree, but to leave here with your mind intact as well, okay? We are here to be a part of that journey and to support you the entire way. So I am not going to keep you guys beyond our time. It is now 3:25, and I just want to take a moment to thank you for joining us this afternoon. This is the third of our 4 sessions, and I would be remiss if I did not thank you all for being here. I see Nafessa has a quick added.
Very quick added statement, and this is to help also relax any feelings of nervousness or anxiety that may come with the idea of accessing resources for your mental health. I want to say to you, all great therapists have a therapist or have had a therapist at some point in their journey, because it is absolutely asinine to have someone sit in front of you in the seat of vulnerability to share their life with you, and you have not sat in that same seat as well.
Thank you. Thank you so much. So again, that's one of those areas to normalize what we're doing. Come on out, get some help, talk to someone. It could change your life. I went ahead and placed the assessment in the chat, so I invite you to complete that. Go ahead, Ben.
Excuse me, as a minority person, if you know anything that will prevent you from seeking help here, or things that you observe that is preventing you from coming, those are the things I'm waiting for. Please let me know. Like Nadia said, we are all working so hard to make this place comfortable for everybody. Please communicate. We are open and willing to work with you to correct whatever. Thank you.
Thank you so much, Ben.
Dr. Johnson.
Absolutely.
Sorry, may I plug the Healthy Mind Study, because that's what we're trying to get to.
Go ahead.
Just to dovetail off of, I'm Dr. Ashley Roberts. I'm working with Dr. Ezioki on the Healthy Mind study. So we sent that out to students. You would have had at least 4 reminders, individual links in your inbox. This is the last week to fill that out, but we are trying to improve those services, and we do have an underrepresentation of Black and Latinx responses, as well as responses from all male students. So please take that survey. Because it will help us develop our strategic plan. We're going to come into it with a racial equity mindedness in place to develop that plan, but we really want to hear the student voice and experience as well. So that's going to be an excellent way for you to make sure that you can share anonymously your experiences in help seeking and some other experiences you're having around mental health and support.
Thank you, Dr. Roberts. Please take that survey. This is your opportunity to be heard. We want to hear you. You guys are seeing these new programs, and you're seeing the enhanced visibility of Black and Brown resources here on campus because we care about your needs. We cannot address them if you don't let us know what they are. So please take the survey, and we invite you to come out to our final session of the Black Lives Matter series on April 15th. It is promised to be a good time. We're going to be talking about Black culture, all the way from the ways in which we've impacted pop culture, to dance, to jazz, and so much more. So please come out to our final session on April 15th. Thank you again for your continued support of this series. And I look forward to seeing you all in just a few weeks for Black Culture Matters. Have a wonderful afternoon, everyone.